So one thing that I have come to realize is that we serve a false god within the realm of medicine and health and wellness, and that false god is the normal reference range that has been um, defined by humans. And even laboratory testing in itself, there's so many different things that should be brought up about the accuracy, where we even get the reference ranges, and how often that shifts to accommodate to a sicker and sicker population. That, however, is not what I want to talk about today, but I want to talk about the actual inconvenient truth that is, you are serving a false god, which means the lab range, the reference range, and having a perfect lab result has absolutely nothing to do with your health and vitality. People with absolutely perfect labs can die, and people that don't have perfect labs can live a fully functional and vital life and not even have any idea that anything was off in their blood to begin with. So when we talk about labs regarding we're testing for blood, you are testing something that the body regulates tightly. It does everything within its capacity to keep homeostasis within all of these different markers within the blood, which is what we're testing. So when you go get your labs drawn, they're testing your blood for most of them, unless you're doing a salivary or urine testing or something else. But specifically, we'll just make it really simple with the blood. This is a reflection of how the body is compensating to keep you alive. And so what medicine does is we go and we measure those things, which are not a true depiction of who you are by the time you get the results, which is another problem. They have already changed drastically because the body is dynamic and it's ever changing, and just the stress response from the needle can alter your labs. Having different B vitamins before you get your labs done can change the interpretation of the labs. Having a little bit more water, fasting, being happy, crying, having a stress response prior to, being really stressed at work, or even the alternative, laughing really, really hard on the phone before you walk in. All of these things can change your labs. And this is a beautiful part of the human body, but the way medicine does is that we take a snapshot of time and then we define you by that. And then everything that we do, every intervention that we have, is solely targeted, not at you feeling good, but at you testing your blood again to then be in a normal range that has been defined by man. When the reality of the situation is your blood is a reflection of your body's compensation mechanisms to keep you alive and well. And what we do is we go and manipulate the what and never try to understand the why. And so this is something that we've got to really come to terms with and look at it through a different perspective of, this is a data point at best. And it's ever changing. And the person you are today is not the same person you were when they tested it. And even our testing, the efficacy of all of these things is not, it shouldn't be this big thing that we serve. And we should not be doing everything to manipulate human physiology and biochemistry to put humans in a reference range. There is no amount of vitality and life that can be found in a laboratory reference range. And so with my patients, we use this to redefine the physiology, how their body compensates, the language of their body. We give them a new story, and it's not just a one-to-one. Low iron, they need iron. Low B12, they need B12. But the totality of, with what we have access to with regards to lab testing, the totality of the story as best we can understand based on that moment in time, knowing that you're a massively different human being today. So if you are doing everything in your power to serve the false god that is a laboratory reference range at the expense of your vitality, your health, and your life, we've got to reframe this. Because the truth of the truth of the truth is, it doesn't matter what your labs look like. The capacity to be a vibrant, fully functional human being says less about a reference range and more about how you're living the life that you're getting to live, and your body's capacity to accommodate to every input that you are exposing it to in your life. And so if we can just kind of start asking some better questions, and even today having a conversation with the patient, her words were, my labs look perfect, but I don't feel good, and I just want to feel good. And so it's such a powerful thing to think about, that your labs being perfect based on the manipulation of your biochemistry and physiology has absolutely nothing to do with how good you feel. It can give you information with regards to how your body compensates. But to go and alter the blood and not understand why the body is changing the blood to look the way it looks is a big flaw in medicine. And so just for peace of mind, and just to kind of give you back some of your power, take your power away from serving laboratory ranges, from serving what you've been told a healthy human being looks like, acts like, smells like, and behaves like, and start just asking a couple little simple questions of, even just the simplicity of, do healthy people care about what their labs look like? Does somebody who's so vital, so just filled with life and aliveness, could you come and sell them that they need the latest and greatest testing? They wouldn't give a shit, because they're living life fully and they feel good. The whole point should be to feel good, not to have perfect lab results. If we need to use lab results as a data point, that's fine. But to do everything that we do to manipulate something that the body's doing by design just doesn't make any sense. And so this is just a piece of the conversation. There's so much more to this, but the freedom lies in the truth that the reference range doesn't matter, the labs don't matter, but how you feel matters. How alive you are in the life that you get to have matters. And so don't serve those reference ranges. Don't hang your hat on what they said one time. Even if it was a week ago, you've changed. You should change. You will be massively different even an hour after you get your labs done. And so there's just so much more to you. There's so much more to being a human, and there's so much more to the body and your health and your vitality. So loosen the grip on some of these things that capture you, that force you into a fear state, that makes you do all of these things to manipulate this thing to change a value. Flip it around. Go do life. Living, enjoying, breathing, tasting, dancing, moving, communicating, being with people is medicine. Everything else that we're doing is just a manipulation of physiology.